Many doctors that I've spoken to have always wondered, how did a patient become so stricken with chronic illness? Why didn't he make lifestyle adjustments when he was younger? Why did he leave it too late? Why only now that he comes to me when he's so sick? I can relate to that inaction. When I was younger, in my 30s, in my 40s, you feel almost invincible. You will never fall sick. And I didn't feel the need to take care of my health too. Then a doctor friend of mine kept nagging me, go for health screening, go for health screening. He sees me, he says, go for health screening. Since he's my friend, I listen to him. Then after tests, he found that I have quite high levels of cholesterol. And based on my risk level, he performed further tests and found a very small calcium deposit in my heart arteries, in one of my heart arteries. So at his advice, I started taking some medication, adjusted my diet. Essentially, nothing very austere. I have to cut down chili crabs, prawns, and sotong. Not a huge sacrifice, yeah, as Mr. Pritam Singh is acknowledging. That's austere. No, I can still eat them once a month. I just don't eat them every week, every other day. So eat in moderation, but certainly not deprivation. Anyone want to treat me to jumbo seafood? I'll say yes. My readings, I just went 2 weeks ago, did my readings. They are now fine. More importantly, because of early intervention, I probably averted a major heart bypass surgery when I become old. Or worse, a heart attack that may kill me and distress my family and my loved ones. We usually associate better healthcare with fascinating medical technology or heroics in the operating theater, that when we watch Grey's Anatomy. Those are important, but good health is more likely to come from an accumulation of the humdrum and the mundane. Because as the saying goes, prevention is better than cure. We need to, as Mr. Ong Ye Kung and Mr. Henry Quek said, maintain health rather than treat sickness. That's why we are not called Ministry of Sickness. We are called Ministry of Health. The measures must be taken early when the person is still healthy. We must identify the risk factors in our lives that will erode our health slowly and quietly, and then address these factors. It must be done in homes and in the community, not in hospitals or clinics. It is best centered on family doctors in polyclinics and GP clinics, and less on surgeons and specialists in hospitals. Family doctors must then become the most important anchor of our healthcare system.